No surgeon could get close to the dying Marine general, but the newest nurse in the trauma wing whispered a call sign that had been buried in classified files for 6 years, and the most violent man in the room went still like a soldier receiving orders from beyond the grave. At Walter Reed National Military Medical Center, Nurse Elena Marquez was known for exactly 3 things: trembling hands, quiet apologies, and staying out of the way. She kept her dark hair in a loose bun that always seemed half undone, wore scrubs a size too big, and avoided eye contact as if confidence were a language she had never learned. Dr. Adrian Cole, the hospital's celebrated trauma chief, made sure everyone noticed her shortcomings. Marquez, the 4 goes in the left arm for pre-op. Left, he would snap, loud enough for interns to hear. The residents would exchange knowing looks. She would murmur, "Yes, doctor," and lower her gaze, her shoulders folding inward as if trying to disappear. No one looked twice at the faint scar along her collarbone or the thin white line tracing her left eyebrow. Both easily dismissed as childhood accidents. For 8 months, she had cultivated the image carefully. Average nursing school in Arizona, no military background, bland references, a spotless but recent credit history. Forgettable. That was the goal. Because forgettable people were never investigated. The emergency department moved with mechanical precision that afternoon until the double doors burst open with a shockwave of noise and desert dust carried in on uniforms. Clear the bay. Clear it now. 4 Marine escorts rushed in with a gurney moving at full sprint, and the man strapped to it looked less like a patient and more like a battlefield barely contained by straps and blood-soaked gauze. 4-star Marine General, General Victor Maddox. Multiple GSWs, thoracic and abdominal. BP crashing. He's combative, sedation ineffective. The room shifted from routine to crisis in seconds. Dr. Cole strode forward, command voice rising. Trauma 1. Call vascular. 2 units, ONEG ready. Get restraints on him. But restraints didn't hold General Maddox. He tore one free with raw force, swinging an arm that sent an orderly crashing into a supply cart. Monitors clattered to the floor. Contact front. Fall back, he roared, eyes wide and unfocused, reliving a battlefield only he could see. He rolled off the gurney despite blood pooling beneath him, scanning corners with terrifying clarity. Security hesitated. No one wanted to tackle a decorated general whose fists still moved like trained weapons. Sedate him, Cole shouted. Push 200 of propofol. That dose could stop his heart, a resident protested. He'll stop someone else's first. The general grabbed a metal 4-pole and swung it in a defensive arc, forcing 3 people back at once. He wasn't flailing blindly. He was calculating angles, reading threats, reacting with lethal efficiency even as his life poured onto sterile tile. And in the doorway, Nurse Elena Marquez stood very still. Her trembling stopped. Her breathing slowed. Her posture shifted, subtle, balanced, weight distributed evenly on the balls of her feet. She wasn't looking at the blood. She was reading him. Pupil dilation, muscle tension, the rhythm of his movements. Combat-induced delirium triggered by catastrophic trauma. Mind stuck at the moment of ambush. He wasn't attacking the hospital staff. He was defending his team. The security team moved in from 2 sides. That would escalate him. Someone would get killed. Or he would. Elena stepped forward. Marquez, get back. Dr. Cole barked. She ignored him. Hands open. Palms visible. Slow steps. The general's head snapped toward her. Stay down, he barked. RPG at 12. She didn't flinch. General Maddox, she said softly. No response. She took another step. Sir, you're not compromised. He staggered, trying to focus on her face. Hostiles, negative, she interrupted, and her voice changed, not louder, but sharper, precise, unmistakably military. Threat assessment complete. You're stateside. Walter Reed. You're safe. The room heard it. The shift in tone, but didn't understand it. The general did. His eyes narrowed, searching her face. She moved 1 step closer and leaned toward him, close enough that no one else could hear the next 4 words. Reaper 6, stand down. Silence detonated through the trauma bay. The 4 poles slipped from his hand and clanged against the floor. The general stared at her, as if seeing a ghost materialize from smoke. Phoenix, he whispered, disbelief cracking through pain. You're dead. A flicker of something almost like a smile touched her lips. gone in an instant. Reports can be wrong, sir. His knees buckled. She caught him before he hit the ground, controlling his descent with effortless strength that did not match her frame. Let us treat you, she murmured. You're bleeding out. His massive hand gripped her wrist weakly. Kandahar, you pulled me out. Focus on breathing, she said. That's an order. And like a soldier obeying a superior officer, the 4-star Marine general allowed himself to be lowered back onto the trauma bed. The fight drained from him completely. Yes, ma'am, he breathed, before losing consciousness. For several seconds no one moved. Dr. Cole stared. The residents stared. Security lowered their weapons. The timid nurse with shaking hands had just done what 6 armed professionals could not. Elena stepped back, shoulders curving inward again, eyes dropping to the floor. Her hands resumed their slight tremor, as if someone had flipped a switch. We should probably intubate, she whispered. He's lost a lot of blood. Cole blinked, recovering. Move. Everyone move. The team surged into action, but more than one pair of eyes kept drifting back to Elena Marquez. Because generals do not respond to random nurses with classified call signs, and men presumed dead do not answer to ghosts. As blood transfusions began and surgeons prepared to operate, the legend of Reaper 6 lay on the table fighting for his life, and the woman who had called him by a name buried in blacked-out files stood quietly in the corner, once again invisible, as if she had never risen from the ashes at all. By midnight, General Victor Maddox was alive, but only just. Surgery had lasted 4 hours. 2 bullets removed, 1 fragment left too close to the spine to risk extraction. Blood pressure unstable. Oxygen borderline. The kind of fragile survival that could vanish with one mistake. He was transferred to a secured ICU wing inside Walter Reed National Military Medical Center, guarded by armed Marines outside his door and monitored by hospital administration as if the building itself might be a target. Officially, the general had been injured in a classified training accident. Unofficially, no one believed that story, especially not Elena Marquez. She had been assigned as his night nurse, a decision Dr. Adrian Cole claimed was coincidence. It wasn't. He wanted to watch her. Keep him sedated, he ordered before leaving. If he becomes combative again, call security immediately. Do not attempt to handle it yourself. She nodded, eyes lowered. Yes, doctor. The timid nurse routine remained intact. But once inside the ICU room, alone except for one Marine corporal posted in the corner, Elena's movements changed. The trembling disappeared as she checked the ventilator tubing, recalibrated the infusion pump, and reviewed the surgical notes with quiet intensity. Entry wounds tight grouping. Professional shooter. Close range. The general hadn't been caught in crossfire. He'd been executed and failed to die. She adjusted his foreline gently. You always were hard to kill, sir, she murmured under her breath. The Marine corporal watched her carefully. Ma'am, he said after a moment. What did you say to him in the trauma bay? Elena blinked, shoulders shrinking. I just told him he was safe. He called you something. Phoenix. Her heart skipped once, controlled, contained. He was delirious, she whispered. Combat confusion. The corporal didn't look convinced. But before he could press further, the heart monitor chirped, subtle at first, then irregular. Elena turned instantly. Heart rate climbing too fast. Rhythm unstable. She stepped closer to the four-pole. That's when she saw it. A secondary injection port she hadn't set up. Fresh puncture in the tubing. Clear residue in the line. Potassium. Her pulse slowed instead of racing. She scanned the room and noticed the night shift nurse charting near the doorway. Male. Early 30s. Badge red. Daniel Price. She had seen him before. Quiet. Efficient. Forgettable. The monitor spiked. Ventricular tachycardia. Elena moved without hesitation. Corporal, hit the code button, she said, voice calm, authoritative. Not trembling. The Marine obeyed instantly. She clamped the 4, ripped the contaminated line free, and reached for the crash cart before anyone else entered the room. Calcium gluconate. 10 milliliters, she ordered as staff rushed in. Dr. Cole arrived seconds later. What happened? Hyperkalemia, Elena replied evenly. Induced. His head snapped toward her. Induced. But she wasn't looking at him. She was watching Daniel Price. He was backing toward the exit. Too controlled. Too steady. She moved. Fast. In 3 strides, she reached him before security understood what was happening. He swung first, not like a nurse, but like someone trained. She deflected the strike, twisted his wrist, and drove him to the ground in a clean joint lock that forced a sharp cry from his throat. The hallway fell silent. "Do not move," she said quietly, knee pressed between his shoulder blades. The timid nurse was gone. In her place stood something else entirely. Security rushed in. The Marine corporal stared in disbelief. "He injected potassium," Elena said. "Check his pockets." They found a small vial. Unlabeled. Professional grade. As they dragged him upright, Daniel leaned toward her and whispered, "You should have stayed dead, Phoenix." Dr. Cole heard that. Everyone did. Elena's grip tightened just slightly before she released him to security. The code team stabilized the general after 2 shocks and aggressive countermeasures. His rhythm returned. Fragile, but steady. Once the room cleared, Dr. Cole blocked Elena from leaving. "Who are you?" he demanded quietly. She lowered her gaze again. The tremor returned. "I'm a nurse." "You executed a Marine Corps close combat disarm technique," he snapped. "You diagnosed induced hyperkalemia in seconds. And he called you Phoenix." She looked up slowly. For a split second, something cold and battle-worn flickered behind her eyes. "Sometimes patients say things when they're dying," she replied softly. "But security footage doesn't lie. By 0200 hours, hospital administration was reviewing it. The way she moved, the way she spoke, the way a 4-star general surrendered at her command." In the ICU room, General Maddox stirred briefly from sedation. His eyes cracked open. He saw her silhouette against the dim monitor light. "They're inside," he rasped weakly. "Iron Veil, traitor at command level." She leaned close. "Rest, sir." His fingers closed around her wrist with surprising strength. "You survived Kandahar," he breathed. "Don't let them bury you again." The machines beeped steadily. Outside the room, federal investigators were arriving. Inside, Elena Marquez stood very still, staring down at the man who knew her real name. The one carved into classified mission reports and folded into a flag that had never reached a coffin. Captain Elena Marquez. Force Recon. Call sign, Phoenix. Officially Kia. And now exposed. Somewhere in the city, the people who had tried to kill General Maddox would learn he was still alive. They came before sunrise. The hospital lights flickered once, then emergency power washed the ICU hallway in red. Marines at the door tightened formation. Federal agents reached for radios. Elena didn't wait. The first breach hit the south stairwell. Controlled explosion, suppressed gunfire. Professionals. Not chaos. A clean execution team sent to finish what they started. She moved down the corridor with a borrowed rifle, no tremor in her hands now. The timid nurse was gone. The first operator rounded the corner. 2 shots. Center mass. Down. The second tried to flank through a supply alcove. She anticipated it, stepped inside his angle, disarmed him, and dropped him hard against the wall. Efficient. Final. Then a crash inside the ICU room. A ceiling panel exploded downward. One last attacker dropped through, rifle aimed at General Maddox's bed. Elena sprinted. She hit him mid-aim, driving him off balance. The shot shattered equipment instead of bone. They slammed to the floor in a violent struggle. Precise, brutal, controlled. He fought like someone trained at the highest levels. "Phoenix," he hissed. "You were supposed to be dead." She twisted his arm until the weapon fell free. "I'm hard to bury," she replied. Within seconds he was pinned, bleeding, breathing hard. "Who sent you?" she asked. He hesitated. She leaned closer. "Vice Admiral Grant Holloway," he finally rasped. "Operation Iron Veil." Maddox found the proof. The words changed everything. By afternoon, secured evidence hidden in Annapolis exposed Iron Veil, the legal black sites, missing operators, and orders linking Holloway directly to the assassination attempt. By evening, arrests were made. By nightfall, the scandal was public. General Victor Maddox survived. Operation Iron Veil collapsed. And the ghost they called Phoenix stood in the quiet ICU beside the man who had once watched her be declared dead. "You could come back," Maddox said weakly. "Full command. Full honors." She looked at her steady hands. "For years I fought wars," she said softly. "Maybe now I save the ones who come home from them." Days later, Elena Marquez accepted a permanent role at Walter Reed National Military Medical Center as military trauma liaison. Not hiding, not pretending, just serving. Because Phoenix hadn't risen to burn again. She had risen to heal.